Welcome to Down in the Bumps, a perinatal mental health podcast that shares stories of women and families who have experienced perinatal mental health problems. My name is Laura. I'm your host and I'm a doctor training in psychiatry. At the end of each episode, I'll share some learning about perinatal mental health related to the story we've heard. Please note that what is discussed in the podcast should not be taken as medical advice, and you should discuss your own medical care with your GP. This time we'll hear Eleanor's story. Eleanor works as a GP. She's married to Robbie and they have a daughter together, Phoebe. We'll hear Robbie's story later in the series. Eleanor shares her story of postnatal depression and post-traumatic stress disorder. There is mention of suicide, pregnancy loss, and sudden infant death syndrome, or SIDS. So if this may be triggering for you, perhaps step away and join us another time. Hi Eleanor, and thank you so much for coming on the podcast. I'm really looking forward to hearing your story today. I thought it might be a good place to begin with you just telling me a bit about yourself.
Yeah, so my name's Eleanor. I'm a GP. I am married to my husband Robbie for 6 years now. We've been together for 10. And we had baby Phoebe, who's more of a toddler now, in December 21.
Fantastic. So obviously today we're going to talk a little bit about your experience of perinatal mental illness and about your recovery as well. Yeah. So I guess it'd be good to know, when did you start to notice that you were feeling unwell?
So we had, so before we had Phoebe, we had 3 miscarriages, which were all equally quite traumatic. And at the time I thought I was dealing with them quite well. And didn't think that I had any issues at that point. After the third one, I was quite low and got some counselling after that one. It was the third lockdown as well, and I think it was just a combination of sort of everything just getting on top of me. So I knew that I was feeling a bit down at that point. That was sort of the beginning of 2021. But then I had the counselling and things sort of improved, and we felt ready to try again. And our 4th pregnancy was successful, so we got pregnant with Phoebe. And my mental health just deteriorated quite quickly when we got pregnant, mainly anxiety. So it sort of switched from being, I was quite low before that, and then it turned into looking back now, quite severe anxiety that I just put down to normal because we'd had the miscarriages. It was very normal to be anxious. We found out quite early we were pregnant. So it was just anxiety, and I kept saying to myself that it would get better. You know, once we'd hit the 12-week mark, you know, which we hadn't got to before, things would improve. And then it didn't. And then I was like, okay, once you get to 20 weeks, you've had the anatomy scan, you'll feel better. And it just didn't. And it just kept spiraling. And at every point in the pregnancy, there was something that I was anxious about. But I just, you know, me and sort of everyone around me just sort of put it down to, well, that's understandable. You know, you've been through 3 losses before, you're going to be anxious. And I sort of said to myself, you know, when she's here, it'll all be fine and it'll all sort of settle down. So I didn't really think it was that my mental health was particularly bad at that point, but I did know that sort of I was probably more anxious than I should have been or would have been had we not had the losses, I think.
Yeah. And how was your physical health during pregnancy?
So that wasn't brilliant either. I had quite bad morning sickness. Well, it's not morning sickness, is it? It's all day. And I had that throughout the pregnancy. So that never got better. And again, that was the same. It was, you know, once you get to 12 weeks, it will improve. Once you get to 20. So that didn't help. But I was okay. I was managing. But I think I did put a lot of my health, I put down to being a lot of issues to do with the sickness. Yeah. And actually, when you look at it, I think a lot of it was more anxiety. So, you know, no energy, I wasn't sleeping, no interest in anything really. I was just so like on edge all the time. And I put a lot of that down to not being well physically.
Yeah.
And actually, I think it was probably a combination of both, but a lot more anxiety than I thought at the time.
At what point did you recognise what was going on and seek some help?
So I had a growth scan because one of the midwives had said that I was measuring big, and then she was actually measuring quite small on the scan. And I'd gone on my own because Robbie had issues getting off work, and I just absolutely collapsed on the midwife because I just couldn't cope. And usually when I'd had a scan, I'd feel better for a small amount of time because, you can see the heartbeat, you can see that everything's okay. And I just couldn't cope. I was like absolutely sobbing. And she sort of said, oh, is everything okay? And I was like, not really. I just said, I'm just really anxious about her sort of getting here and something going wrong. So they referred me to the perinatal midwife, and that was at I think it was about 28, 30 weeks.
And was that midwife that you ended up talking to, was she someone that you had a relationship with, or why do you think it was at that moment that you chose to talk to her?
I think it just all built up because it was just one of the, I'm not even sure if it was a midwife, but she was just on the day unit with doing the scan, and it had just all built up. So I didn't know her at all. And actually all of the midwives I saw it was never the same. They were all part of the same team, but it was never the same midwife. So I never really built up that rapport with anybody. And I think it had just hit, my anxiety, because I hadn't slept for a few days before the scan, and it just all got a bit too much, I think.
Yeah. So you referred to the, you say perinatal mental health midwife, yeah. And then at what point were you referred into the specialist perinatal community mental health team?
So I had an appointment with the midwife, specialist midwife, and she sort of did a lot of the screening questionnaires and had a long chat with me, where again I was just sobbing. And she said, actually, I think this is more serious than just sort of a bit of anxiety, and I think you need to speak to the psychiatrist. So it was from her that I was referred in.
And when you were referred in, what sort of interventions or treatments were you offered?
So at that point, I think I was about 34 weeks, and the doctor I spoke to was really keen to put me on some medications. So she wanted to put me on citalopram, but I was just far too anxious. As a GP, I prescribed them all the time in pregnancy. The logical part of my brain knew that it would be fine and it would probably help, but I just couldn't do it. And I just had this big fear that something was going to go wrong. So I said no to that. And I said, as soon as she's out, I'll start anything. I'm not bothered about that. I just can't have them when she's inside. And so I asked for some therapy at that point, but the doctor said it was too late at that point for therapy, because I thought I just needed someone to sort of talk to. But that wasn't really offered. So it was just sort of watch and wait, really, at that point.
Yeah. And then what happened next?
The anxiety obviously didn't really get much better. Phoebe was breech, which turned out to be the best thing because it meant that I could have a planned section, which for me was the best kind of birth I could have had, because just in my head, I just thought something awful was going to happen. So the fact that I knew when it was going to happen, I knew it was going to be a safe procedure, that for me was just the sort of the best thing. And the decision was taken out of my hands. It wasn't sort of anything that I could have controlled. So she was delivered she was 38 and a half weeks in the end, because she was still a bit small, and I had a bit of issues with my blood pressure at the end. So it was just sort of like, let's just get her out. But I do think the majority of that was to do with me being so anxious. But they didn't really say that. But, when you look back, you're like, actually, I was just so anxious about something happening to her before she came out. And, obviously she was born, and I was just in a bit of shock, to be honest, because I hadn't let myself bond with her at all in the womb. So, and, it was lovely. I could feel her kicking, and obviously you see on the scans, but I just couldn't, in my head, I couldn't let myself attach to her, because I felt like something was going to go wrong at every point. So if I let myself think that this was going to happen, then something bad would happen and it would just be worse. So it was just this sort of shock that she was here. And then, of course, she's sort of in that sort of newborn bubble bit. I was desperately trying to breastfeed, which wasn't going very well. And it was just sort of a bit of a whirlwind, to be honest, the first sort of few weeks. And I was just so like in our own little like world of newbornness that we didn't really think about my mental health. I actually thought I was fine. I spoke to the psychiatrist, I think it was about 4 weeks after delivery. And actually at that point, I said I was fine. So, I said, oh yeah. And, I wasn't sleeping, but I put that down to the fact that I had a new baby. I was really anxious. I was really struggling to breastfeed. So the feeding was a big issue. And I just put everything down to that. So I said to the psychiatrist, I was like, actually, I don't think I need medication. I think I'm much better. She's here. And so the psychiatrist was like, okay, well, we'll just keep an eye on you. And then, so for the first 8 weeks, it was pretty awful because of the feeding. Okay. So my anxiety hadn't really gone at all. So in my head, I was like, right, as soon as she's here, everything will be fine. Everything will settle down. And before delivery, I had said, I don't care how I feed her, fed is best. Obviously I'll try and breastfeed. I'd love to breastfeed, but, I'm not going to put any pressure on myself. And of course that didn't happen. So my anxiety from her being well just completely went to the feeding. And I didn't have enough supply. So I was trying to pump. I was on a 2-hourly regime where I would to feed her for an hour, then top her up with formula and then pump. And we were supposed to do this every 2 hours. And I was just losing my mind, basically.
Understandably exhausted,
So I just couldn't sleep. I was constantly feeling that I should be either feeding her or pumping. So I just wasn't sleeping at all. And it all just sort of came to a head at about 8 weeks. And I just couldn't do it anymore. I couldn't even hold Phoebe at that point. I was like, I can't even look at her. And Robbie at that point was like, you need to speak to someone, like this isn't normal. So at that point, I actually rang the sort of emergency line that the perinatal health team give you. They were really lovely. And they said, don't worry, we can, we'll help you. And the consultant rang me back and we had a long chat, and she said, look, I think you need to start some medications. I was like, yeah, I do too. So at that point I started citalopram and stopped breastfeeding. And those sort of two things really helped. So I thought I'd got better quite quickly at that point. Robbie was also off work for a bit because he was changing jobs. So I had someone else there, which also really helped. And things got a bit better. So my sleep never really improved. But again, I put that, when you've got a new baby as well, you never really sleep anyway. Robbie actually started sleeping with her and I slept in a separate bedroom because every little move or not move, I would worry that she was not breathing. I was so worried about cot death. So I found that really hard. So actually I had to sleep in a separate bedroom because I just couldn't cope with, lying next to her. Which did help slightly. So things sort of improved for a few months. But I still wasn't right. I was just sort of carrying on with things. So my way of dealing with it was to be as busy as possible. So I went to every baby group. We were going to at least one every day and then meeting friends. In the afternoon, I was so desperate to make mum friends. I was like, this is the time, you've got to make your mum friends. So I was really pushing myself to go out. So we didn't really have any time to think. And I found that the easiest way to deal with things. But it just meant that I wasn't dealing with things. I wasn't thinking about anything. And it just sort of, so my mental health was just getting worse and worse, really, at that point.
Yeah. And then I guess at some point, somebody mentioned to you the idea of being admitted to the mother and baby unit. And you did accept admission to the mother and baby unit. How was your time there?
It was the best thing to have happened at that point. But I was, at the beginning, I was absolutely horrified that I was going to go in. So my mental health had been declining for months. So by the September, so she was 9 months, I was just an absolute mess. I'd sort of got to the point where, prior to that, I hadn't been suicidal. And then it came on really quickly, was like, oh, actually, I am starting to have thoughts of ending my life. I had this whole plan of what I would do. I at this point thought Robbie, in my head, I knew he would understand. And in my head, I thought Phoebe would be better off without me. but I knew I couldn't do it to my mum, and I just wasn't functioning at all. So I told Robbie how I was feeling, and then we got in touch with my psychiatrist. We were trying to keep me out of hospital because I was desperate not to go in, because in my head that meant that I'd completely failed at motherhood. And also, no one really knew what was going on at this point, apart from Robbie. And if you're admitted to hospital, you have to tell people. And everyone knows. And I really, really didn't want anyone to know what was going on. But I got to the point where I knew that, you know, something bad was going to happen. So we went in. And it was... when I got there, I was in such... and all the way through, I've been in denial about my mental health. I still thought I was fine. And they talked to me about this on the ward, about how your brain tries to trick you. So my brain was just telling me, you're fine, you're making this up, you're just doing this for attention, you're not unwell, like, what are you doing in here? And there were a lot of other sick women in there that I was comparing myself to, and I was saying, look, I'm not as bad as them. And it took me a good 2 or 3 weeks to actually accept that I even needed to be there, which I think, looking back, was actually part of the recovery itself, was me being like, oh, do you know what, you are actually quite unwell. And talking to the other women that were there was so helpful, because we were all having very similar thoughts. And it was quite nice to know you weren't the only one. And, you know, the main thing was you have to slow down on the ward. And I found that really, really hard. You know, I was in my head, I thought I was going to go in and we were going to have therapy every day, and it was going to be loads of like, come on, let's get you out, let's get you out. And it was the complete opposite. But that was what we needed to do. I needed to, you know, be with Phoebe and do, you know, and they do lots of like arts and crafts and like baby things on the ward, and things to just really slow you down, which was one of the best things, I think.
Good. And then coming up to now, and thinking about what happened next up to now. How did things go? How are you now?
So I am much better. I'm still not 100%, and I'm coming to terms with the fact that it is a really slow process. And I think in my head, I thought, you know, I'd go onto the mother and baby unit, I would be discharged and I'd be better. And it doesn't work like that. So I was on the ward for about 8 weeks. I changed medication, which made a massive difference. And it was when I was on the ward as well. So it's probably a combination of everything. But I do think the medication had a massive effect on how I was feeling. I've been given some sleeping tablets as well, which again was key. And they were very good about saying, actually, the key to good mental health at this point is the right medications, sleep, and looking after yourself. So good diet, trying to get some exercise, things like that. And actually that's the key part, you know, because you're not going to feel well if you're not sleeping.
No.
When I was discharged from the ward, it was just such a high, because I felt like I'd done so much work. I was feeling so much better. I wasn't suicidal. I got out just before Christmas, and we had Phoebe's first birthday. But then after that, in January, when I was home, I had quite a big dip again. But you're still, when you're discharged from the ward, because you're not better, you're just well enough to go home, you're still under the perinatal team. So I had so much support when I came home. So I had a nurse, care coordinator who's been amazing. So she was talking to me, you know, sometimes it was more than once a week, or just whenever you needed. And I started therapy. So I started therapy on the ward, and then we carried on with that. That was once a week, which again really helped, and spoke to the psychiatrist as well about the medications, and that was still really frequent as well. So all that really helped, and they were able to make me see, you know, you're not as bad as when you went in, you know, things have improved. It is going to take time, and just to sort of slow down my expectations of I need to be well right now. So it's been a bit of a process of retraining my brain to think completely differently, basically.
Yeah, and just to slow down and not to have, I guess, those expectations.
Slow down and slow down my expectations. So yeah, it's been a massive learning curve. But yeah, the mother and baby unit was definitely the best thing to have happened.
Good. And how are you and Phoebe now? Because obviously there's one point where you didn't really have much of a bond with her, and you were scared of feeling that bond. But how's it now?
Yeah. And that's massively improved, and that I really, really struggled with my bond with Phoebe. And it was really hard to admit that, because I think there's all this stuff in, TV films, and just generally, one, pregnancy is amazing. Well, I hated pregnancy. I was not a glowing pregnant woman. And then, once the baby's here, you'll feel this massive rush of love, and it'll be like nothing you've ever experienced. And I still to this day don't feel like I've ever had that. And whether my expectation is just it's just ridiculous. But the bond, and it's taken a long time. So even when I was discharged from the ward, that was still the bit that I was struggling with, was seeing that I had a bond with Phoebe, and it would make me so upset because I really struggled with that. And after everything we'd been through, she was so wanted, and I couldn't feel that bond. I've done a lot of therapy chatting to the therapist about it, and how, because of the losses, and because I wasn't able to imagine her being here when I was pregnant and attached to her, it had just gone, further than that. And even now to this day, the thought of fully loving her as much as I want to, or that I know I do, is so scary, because I still have that thought that that something's gonna happen, and that she's gonna go. So it's been it was really helpful to know that, one, it's part of postnatal depression and anxiety, and because of the losses, it was a normal response. It's normal for you to think that something might happen to Phoebe as well. So things are much better, and also she's now at the clingy sort of phase of not wanting to let me go, which has helped. Because there are some things you can't, I can't pretend that she doesn't come to me, and whereas when they're younger, it's a lot more difficult, because she was so smiley with everybody and happy with everybody. It was just really hard for me to see that we had a bond, and I found that a bit easier now.
Great. Is there anything that you want healthcare professionals to know?
I think there's a few things. So one of the main issues that Robbie and I have talked about is the fact that I didn't get any therapy or any sort of psychological support earlier on. So I think that would be one thing that I would ask health professionals to sort of think about, is the other side. It's not just medication. It's not just keeping an eye on someone. Actually, can you help them at that point? Robbie and I still feel, and I don't, you can never say never, because what's happened has happened. But if I'd had the intervention that I've had since discharge, if I'd had that before I went in, would it have prevented an admission? And we'll never know. And I think from our point of view, I should have really been pushing that as much. But it's hard when you just go along with people. Even as a healthcare professional myself, you just agree, you're like, oh, they know best, and okay, that's fine, we'll do that. And actually I should have really pushed for a bit more support earlier on. And I think the other thing is, so for me, I think the losses that we had, the miscarriages that we have had a massive impact on what's happened, and whether I would have got postpartum depression anyway. But I've got some PTSD symptoms from the miscarriages, and I think it's all sort of combined together. So, and a lot of women on the ward had issues like that, or had struggled to get pregnant with IVF, and things like that. And the other one was birth trauma. So I think anything like that is such a risk factor for poor mental health in pregnancy, and maybe just a bit more awareness that that's an issue. Because it was sort of once I'd got past 12 weeks, everyone was sort of like, oh, you'll be fine, because your miscarriages are early. And one, that just made me feel really stupid for still worrying, because I was like, oh, they were really early miscarriages. Like, what are you on about? It's not like you had a later loss. People go through so much worse than you. But it still had a massive impact on me. So I think a bit more, knowledge or understanding about that would be helpful.
Yeah. And is there anything you'd like to say to other mums or families who might be going through similar, or have gone through similar?
So the seeking support early really is key. And from our point of view, family members being a bit more, what's the word? Like standing up for the person, sort of advocating, I think, when because I think the family know you best. Robbie knew me best, and he knew I wasn't coping. But a lot of the calls I was having on my own, and they were on Zoom. So I think being as honest as possible with healthcare professionals that are trying to help once you seek the help is key. But I think one of the biggest issues for us was putting everything down to being a new parent. It's normal. It's normal to not sleep. It's normal to be this anxious. It's not, it is a really hard time. Becoming a new parent is really hard. And that's what I found really difficult, was what's normal. Everyone sort of struggles. No one's, it's very rare for people to not struggle in the first few months. But then when is it that bad that actually you should be seeking help? I think that's really hard. So I think, if you're not feeling just talk to someone, and then even if they can reassure you and say, actually, don't worry, this is normal. But if I'd been honest in those first few months, actually, I wasn't well. So I think being honest, and, if you're not feeling right, speak to someone.
That's some fantastic advice from Eleanor. I think her story has highlighted something that a lot of people might have felt. That sense of not feeling yourself, but then not knowing if that's to be expected or not, particularly if you've just had a baby and you're sleep deprived. If you're not sure, remember it's not your job to know, even if you are a GP. Like Eleanor said, go and talk to a healthcare professional about how you're feeling. At the end of each episode, I like to offer some information that relates to the story we've heard. Remember, this is not medical advice. I'd like to introduce James, who is a medical student at the University of Manchester. He's going to tell us about post-traumatic stress disorder, which Eleanor mentioned. Over to James.
Post-traumatic stress disorder, or PTSD, describes a cluster of symptoms that may affect someone's long-term mental health, specifically for more than 4 weeks following a traumatic event. It's hard to say who will be affected by PTSD, as there are a large number of factors that determine long-term response to an adverse experience. It's quite a common condition, affecting around 1 in 25 people in the UK. However, it more frequently affects women following childbirth, with this number increasing up to 20 to 30%. This is called postpartum PTSD, and it can be made more likely by having complex circumstances during birth, such as an emergency delivery, prolonged labour, or an unplanned C-section. It's also more likely to affect women who've experienced a miscarriage or lost pregnancy. The symptoms of PTSD can mostly be divided into 3 categories: re-experiencing, avoidance, and feelings of heightened threat. I'll now discuss each of these in more detail. Re-experiencing symptoms might include intrusive thoughts, flashbacks, or nightmares revolving around the birth or the surrounding time. Avoidance symptoms may look like avoiding things that remind them of the event, being unable to talk about it, or having difficulty remembering the birth well, or in some cases, at all. Someone who is experiencing symptoms of heightened threat might find that they are often or always anxious that something bad is going to happen. This may make them feel on edge or easy to startle, and in turn may lead to difficulty concentrating or sleeping. PTSD can affect mood in a variety of ways as well. It may make someone feel low, guilty, easily irritable, or angry, though some people may experience a feeling of detachment or numbness instead. It's important to remember that PTSD is often accompanied by anxiety, depression, and alcohol or substance use. It can also lead to experiencing thoughts of self-harm or suicide. Another thing to consider is that in many cases of postpartum PTSD, a new mother may be experiencing any or all of these symptoms while also dealing with the challenges presented by having a new child. In terms of treatment, the most effective options available for PTSD are trauma-focused talking therapies like cognitive behavioural therapy and therapies designed to help reprocess traumatic memories to be less harmful. This is usually a type of therapy called eye movement desensitization and reprocessing, or EMDR. In some cases, antidepressant medications may also be prescribed to help manage mood and anxiety symptoms in PTSD. For women with postpartum PTSD, Becoming pregnant again may be very distressing, but perinatal mental health support should always be available through the midwifery team. For the majority of people, treatment for PTSD can be very effective, with nearly half of people experiencing no further symptoms after 3 months. However, for approximately a third of people with PTSD, though treatment may reduce the severity of their symptoms, they never become fully symptom-free. Like with many other mental health conditions, it's advised that people with PTSD talk to someone they trust about their feelings, whether this is family and friends, a mental health professional, or a peer support group. If you'd like more information about post-traumatic stress disorder or postpartum PTSD, you can visit mind.org or the Birth Trauma Association website, as these are very useful resources for patients and healthcare professionals alike.